Hi, everybody. I'm sure sorry that we don't have a chance to meet in person, but I think that time is hopefully coming very soon. Certainly for those members of the chamber who have recently become ill, our prayers for you and for your family. Um, so I know that I guess the hot topic is still COVID as it relates to healthcare, and it may be so for a little bit still. I do share um, the thought that, there's some light at the end of the tunnel. And so that's really very good. I'd like to just go through kind of where the healthcare world is, at least the local healthcare world is, and COVID. So to do that, I kind of want to start at the beginning and make sure everyone understands the perspective of where we've been, because I think it gives a better understanding as to where we are. So our anniversary actually for our first COVID patient was like last week, our first one. I think the Lake's first COVID patient was about a week or so before that. So it's been a year. So let me go through the timeline of kind of the way that it rolled early on, and then I'll talk about where we are. So a year ago, we had our first patient. We've been hearing, of course, about other parts of the country in New York and Seattle. Because of the timing of Mardi Gras, the New Orleans market was a early hotspot. So we knew that it wouldn't be too long before we would be there. So New Orleans at this time was really seeing a lot of patients. So I would say somewhere around the end of April, we were fully involved with COVID and patients being admitted to the hospital. And we were still trying to understand on how we treat these patients and what's the best method to keep them well. At the height of the initial spike in COVID, St. Elizabeth Hospital had roughly around 30 to 35 patients, and our ICU, which is 7 beds, was full. Our Lady of the Lake, and so our normal census runs around 35 patients. So you could essentially say that our normal census was entirely occupied by patients that had COVID. Now, we still had other patients that we were seeing, although those numbers were quite a bit smaller at the time. Our Lady of the Lake, at its peak, had somewhere around 250 to 300 COVID patients in the hospital. Their normal census would run around 550-ish, maybe a little more. Their ICU was right around 100 patients, and they probably had 30 to 40 patients on the vent at that time. So that was our initial peak, and those are pretty big numbers. So much so that our ICU capacity was pushed in a manner that we were very concerned that if we didn't have a better grasp of how to manage these patients and or how to prevent spread, that we could fall into a situation in which the most critically ill patients, we ran out of capacity. So just so you know, when a hospital can no longer function in a community, the community actually kind of falls apart. Now, I learned that during Katrina when New Orleans flooded, and it actually wasn't that big a deal until the hospitals went down. Once the hospitals went down, it was mandatory evacuation of the city. And I recognized at that time how important for hospitals to maintain capacity really is. For COVID, we were never going to shut down, but our ability to just be there for the next patient was in jeopardy. This is why we saw alternative care facilities being talked about, even stood up at the Morial Center where a alternative care facility was created. And so, and you saw other parts in the country that was doing had similar projects. So that was our first spike, if you will. And we've had a total of 3 spikes in the past year. So after the first spike, we sort of took a big breath. We were able to kind of get through it. And we started seeing our numbers decline, and we started feeling a little better. Our PPE and our testing and all that stuff improved, and we began to understand the disease process. That improved. So, and of course, our social distancing and mask wearing and all this kind of stuff began to really take place. So our numbers dropped in the hospital, And although our community numbers were still kind of chugging along, they also kind of dropped, relatively speaking, to what they were. So overall, things looked a little better. And we were at phase 1 during that time, that we then moved to phase 2. So then what happened was right around the end of summertime, beginning of winter, we had another spike. Some people said it was 4th of July, whatever. But we felt another spike, and we had our numbers go back up. Here at St. Elizabeth, Our Lady of Lake Ascension, we probably ended up somewhere around 12-ish, 15-ish at the peak of that spike. The lake probably had maybe around 100. ICU is maybe around 50 at the lake. And so, but we kind of plateaued there. And then slowly again, we improved, and things then went back down. We were still at phase 2. The governor still had it at phase 2. And we're still following the same recommendations based on that. Again, more testing ability, more PPE availability. So the big crisis that we had on the first spike about having enough protection and all that kind of became not an issue for us. We've had many team members get sick, recover, and come back to work. So our workforce kind of stabilized out as well, which was a big part of being able to maintain our capacity. So by the end of the second spike, we sort of got through it again. We felt better. And then we started hearing about this variant of COVID, mostly in Europe, first in England. But then we hear something going on down in Brazil. And then we hear about some other variants, don't really know what to make of it all. The data and the information at the time is kind of sketchy. You don't know who to believe. There's some talk that this variant or these variants are easier, to get infected. We really don't know for sure. We don't know how much. There's some that say, they get sicker. We really don't know. But we hear it's out there. So we're chugging along, and our numbers sort of declined again after that late summer spike, the post 4th of July, if you will, spike. And we seemingly are doing better around October, November. And then we start experiencing a third spike. And so we call it the holiday spike, if you will. We know that families and a lot of travel, and of course people shopping and just our normal, trying to do some normal activities is probably why. But so we saw a third spike at St. Elizabeth Hospital. Again, our numbers came up. They weren't overwhelming. Let's say maybe around 10 to 11 at the peak. Not quite as bad as the second peak, and certainly much less than the initial spike. Okay. So Our Lady of the Lake, very similar. Their numbers went up again, probably to 70s, 80s. ICU were maybe around 30s. So very, very much manageable, but again, kind of a shakeup as to, we're not out of this yet. But we did well, and we've done well, and that we just kind of coming at the end of that spike. So that occurred the holidays. So January, we were seeing that, and then sort of by the end of January, numbers beginning to die down. So February, we are still in the phase 2, and we're feeling a little bit better about where we're at. And so the end of February comes along, and our numbers have now have reduced quite a bit. So here we are now. It's March 10th, 11th. We still see COVID patients. I think we have a census today of 1 or 2 in the hospital. I don't think we have anybody in the ICU here.
Yes, we have
one. So Our Lady of the Lake is similar in terms of, they have probably around 30s COVID patients, not overwhelming numbers at all in the ICU. So so I guess the good news on the history of what we've seen is every spike that we've had has been a little bit less than the previous spike. So that's encouraging, whether it's because treatment modalities are better, whether it's because we're seeing less vulnerable people. Who knows for sure? We know that that at this point, the COVID recommendation from the governor has followed in terms of our volume of COVID patients. And so we've gone to phase 3. All that's consistent with what we're seeing, that there's a lull in the number of COVID patients. So, so that's kind of the history. That's kind of where we are. So we'll go back to these variants. So what's happening with these variants? We don't really know. We do feel that there is a change, and that some of them may be a little bit easier, or maybe even a lot easier to transmit. We have yet to experience a significant spike in this country that we can attribute to the new variants. I don't know that that's coming or not. It may be. I would say that with where Texas is, and Florida and Mississippi, who essentially have, opened up more than we are, and they have some pretty good population centers, certainly Texas, who has gone through some very difficult times at times. I think that if there's going to be a significant spike that we can attribute to these variants, we'll probably see it there first. So that'll give us maybe a chance to prepare for that, should that happen. So the bad news is that there's these variants, and we don't really know what they're going to do, et cetera, et cetera. The good news is that the vaccine is effective for all the forms of COVID. So I want to talk about the vaccine now. So that's where we are today, where the governor's gone to phase 3. Our numbers are relatively low. I agree that everyone's kind of feeling a little bit better about the status of where we are. And ideally that continues to move on, and these variants don't become a problem to the degree at which we go back to phase 2. So I'm going to talk about the vaccine a little bit. So, it was when the vaccine, I got my first shot in December. We were the first ones, especially ER docs and frontline people. And then I got my second dose, 21 days later. And the data on the vaccines are pretty compelling. I mean, a lot of people will have some trepidation as to what to believe. And I have every sympathy, if you will, or understanding for anyone that has questions about that. I know that vaccines in many circles have gotten a bad press. Forget COVID, but childhood vaccines and whatnot. The data about vaccinations is extremely compelling, both in terms of childhood vaccines, but the COVID vaccine. I know that doesn't give an individual comfort, because healthcare is very personal, and a person taking or not taking a vaccine is a personal decision. From a community perspective or society perspective, the data is overwhelming on vaccines. And I would argue that the vaccine data regarding COVID fits into that category. I know what COVID looks and does for folks who've been infected and who get really sick. And I feel pretty confident that those folks who are that sick, if I ask them as they're fighting through their illness, if they were offered some treatment modality that would have lessened this just to any degree, my guess is every last one of them would have signed up that day. So it's hard for us when you're not sick, knowing that healthcare is so personal, to easily jump on bandwagons, particularly when trust is an issue. And there's lots of reasons for us to question and have questions about trust regarding things that come down that have not been vetted and tested in a manner that gives you the comfort that you need. The vaccine and the methodologies that create the vaccine, they are not new. They've been around a very long time. The speed at which the vaccine was created was impressive. And some will argue it shakens their trust. I think that, and just a general feeling of trust about federal level government, this sort of thing, feeds the fear that this vaccine is somehow not safe. And I sympathize with everyone's feelings about that, and I don't disagree that there's a component of lack of trust that is probably healthy for all of us. But because I know what COVID does on folks that haven't, or for folks that have gotten ill, and when I look at the data, I'm still overwhelmingly compelled to encourage everyone to get vaccinated. So the risk for those that don't get vaccinated is probably going to go up as more people get vaccinated, because those who get vaccinated, if we accept that the vaccine is effective, will feel comfortable. They may even get COVID, likely will, but they just won't get real sick from it if the data is correct. They may not even know that they're sick at all. So they'll go bebopping along their normal life. They'll be hugging and kissing on each other and doing the normal Southern Louisiana behavior that we all do. And for those that didn't get vaccinated, their risk is probably going to go up, because those that were vaccinated are going to feel so much more comfortable about behaving in a normal fashion. So I do worry that those that haven't been vaccinated may actually end up having a higher risk for exposure. It doesn't necessarily mean they're going to get any sicker than they would have prior to vaccination. It just means that they may find themselves exposed more by folks who have been infected but don't have significant illness or symptoms because they've been vaccinated. So for all these reasons is why I think that the vaccine is the pivot point. I actually think it's a race between our immune systems and the virus. And we either get there one of two ways. You get there by people getting infected with the virus, or people getting infected by the virus and a vaccine. And so that's the only way to turn this tide, period. So I would risk the vaccine over the risk of getting sick, for me. And that's what I encourage all of us to do. And I encourage all of my family, everybody in my family that has qualified to get the vaccine. We've had them line up and get it. I got it. So it opened on Tuesday for me. And back in December, it was on a Tuesday. I got it on Wednesday. So I was one of the first ones in our community to get it. And I'm glad I got it. I'll also tell you that side effects from the vaccine are really not significant in terms of what we're seeing on our numbers. So after the first round of vaccines that went through the state, I want to say that there was about 350,000 vaccines that were given, and there was one significant reaction. And if you do the math on that, right, it's extremely low. Now, there were many reactions. I had one. My arm felt like someone had, given a tetanus shot like 5 times, and it was sore for about 3 days. And then the next dose, I chose the other arm, hoping that maybe it would be better. Yeah, no. The other arm hurt just as much and for just as long. I have seen that folks who have had COVID that then took the vaccine tend to get a little bit more of a reaction than folks that have never been exposed to COVID and then took the vaccine. And the reason being that once you've had COVID, you actually develop an immunity. And the bad feeling, the fever and the chills and all that stuff that one gets when they get sick is really the result of our body trying to fight the infection. So someone who has had COVID, who has immunity already, who receives the vaccine, will elicit a more aggressive immune response than someone like me who had not had COVID. And so they're likely to have more side effects from the vaccine that are consistent with what COVID would feel like. I haven't heard of anyone that's had the side effects in any significant way for longer than 2 or 3 days. And after that, they're usually back to themselves. So having said all that, I think the risks of side effects and the risk of this being pushed through in a fashion that is somehow harmful just are they're just way outweighed, in my estimation, than the data that suggests that you develop immunity and have immunity from the vaccine. So I would encourage all of you, if you haven't received the vaccine, or your family members that haven't received the vaccine, I would encourage all of you to do so. I think at the end of the day, you are either going to get a vaccine or you're going to get COVID. COVID is not going away. It's not going to be something that we eradicate. It's going to be, it's a virus that is a respiratory type virus. And as long as we're breathing and around each other, there is absolutely chance that you will be exposed to it. And I think at the end of the day, we will all have been exposed to it, and we all may have even been infected by it. Hopefully with vaccine, we will not have significant symptoms, and we'll be okay. But I don't think there's any way around society eliminating COVID. It's just whether or not we care, because COVID's effects are mild and they're flu-like, and they won't be debilitating, and they won't cause public health crisis. So that's where we are. The governor's gone to stage 3. I think it's a good move. We'll see what these variants do. We should know probably within a month or two if we're seeing big spikes. I do think we'll see this sort of up and down notion, no different than we see on flu, right? Usually when flu season, we see flu go up. Some years it's not so bad. Other years, oh, it's terrible flu season. So I think COVID will probably follow that sort of pattern. Some people will get very sick. Some people do get very sick from the flu. I think our ability to treat is better. I think we'll continue to have increasing treatment modalities. Usually on the back end of these kinds of things is technology. And I'm anxious to see new medications that are coming out that will help us manage acute illness related to COVID and other viral type illnesses. So if there's good news behind all this, is we will make it, right? It's going to be okay. There will be suffering that has occurred and that may still occur in the future. But I think as a community and whatnot, we're finding our way through it. So I don't know how I'm doing on time. So
I was going to ask a couple questions about the vaccine,
sure.
If that's okay.
Yeah, of course.
Some people, these are things that I've commonly heard, and maybe it'll answer some questions for some people that might be thinking these things. Can you get COVID from the vaccine?
Right. So you cannot get COVID from the vaccine. The vaccine, at least for the Pfizer and the Moderna, and I believe even for Johnson & Johnson, but they're all mRNA. So mRNA is a blueprint that tells the body, make this protein. So every protein in your body is created from a piece or a strand of mRNA, which gives the message to our cells that says, I need you to make this. And our DNA creates the mRNA to do that. And so this virus is mRNA, and they're introducing that into your body. Your body sucks up this mRNA into its cells, and our normal cellular machinery says, oh, look, it's mRNA. What's it telling me to do? Oh, it's telling me to make this protein. Bang, it makes a protein. The protein it's making is the spike protein, and that's the one on the pictures that when you see the little spiky things coming off this round ball-looking thing. So that is a surface antigen, a surface protein. And so our immune system recognizes proteins that are on the surface of things as being normal or not normal. So that spike protein is recognized by our body as not normal. So when the mRNA vaccine is introduced, our body absorbs it, it makes the protein from that and puts it on our cells. Our body then says, hey, what is that? That don't belong here. And our immune system goes and attacks it. The thing is that in order for that to be maintained, mRNA has to be continued to be produced. Okay, in the case of viruses, when they introduce it, the virus then gets into your body and it is producing multiple mRNAs as the virus is spreading. So you continue to have all this protein being created by the existence of this virus. In the case of a vaccine, you're only getting the protein one time, or the mRNA one time. And once it's done, it goes away. mRNA itself is extremely unstable. It cannot survive for very long periods of time once it's created, which is why many of these vaccines have to be frozen, and the timeline at which you can give it is so specific because the mRNA does not survive. So, what you're getting is a piece is a transcript, if you will, of a protein to be made. There's nothing live about it. There's nothing that can live in your body for periods of time. It's a one and done thing, and that's it.
The next reason that we hear a lot of people don't want to get the COVID vaccine, especially if they're childbearing years, is that they're afraid they're going to become sterile.
Right. So there's zero evidence that that is the case. Now, I also tell you that part of the problem with this vaccine is that when they developed the vaccine, they wanted to develop it for the best case scenario and for the most population. So there's many things about the vaccine that hasn't been studied. I got a call the other day from the National Guard that said the recommendation is for the vaccine for COVID to be given independent of other vaccines, that you don't want to give them together, and that you needed at least 14 days between vaccines. Well, anyone that knows the Army, when you deploy to go to another country, they don't spread your shots out, okay? When you're there, and if you need it, you'll get 1 shot, 2 shots, 3 shots, 5 shots, whatever they come up on their list that says, oh, hey, you're missing whatever, you get it. So COVID now, our soldiers need to be vaccinated in order to deploy. And so I got a call that said, what do we do about this 14-day thing? So as I look into it, here's the problem. It wasn't studied. So because it wasn't studied, and they didn't accept people into the study for COVID vaccine unless you had not been vaccinated to address the largest number of population in the country, then they can't give a recommendation as what not to do. They can only give you the recommendation as to what they studied. And so a lot of these things about, oh, this causes this causes that, the truth is it's not studied. So they cannot tell you it won't cause this, but there's no evidence that it does. Just like there's no evidence that COVID vaccine won't work if you give it as in a group with 4 or 5 other vaccines. There's zero evidence that that's a problem, but they can't argue that because it wasn't studied. So there's a lot of information that gets passed around social media and whatnot. You have to really take it with a grain of salt, because the truth is that what we know of what the vaccine, how it was developed, is 100% accurate. But if you ask a lot of other questions that apply to it, they cannot answer the question. It does not mean it causes the problem. It just hasn't been studied.
What is the percent of effectiveness if people get the vaccine?
So the data on the Moderna and the Pfizer is somewhere between 92 to 95% effectiveness in giving you immunity, to the degree at which, if you are infected, your chances of becoming significantly ill are dramatically reduced. So you're going to get to that point after your second dose, and it's usually, they say, somewhere around 10 to 14 days after your second dose that you achieve that level. They say on the first dose, by the time you're ready for your second dose, you're about 80%. The second dose just kind of puts you over the hill, and you get to about that 95%. On the Johnson & Johnson, it's a little lower. It's around 60 to 65% effectiveness. However, they do say that the degree at which you get ICU level intubated is a lot higher than that. Now, I don't have those numbers for the Johnson & Johnson, but to the degree at which you get significantly ill and have fever, and or maybe even need to be hospitalized on Johnson & Johnson, is not quite as effective as the other two. If I couldn't get the other two, would I take the Johnson & Johnson? You betcha. Once I got the Johnson & Johnson, if I then was able to take the others because it became available, I would consult with my primary care. I don't think anyone knows that information yet, because I don't think in the state of Louisiana we've even given out the Johnson & Johnson yet. So all this is kind of being made up as we go along, which I get leads to all the trepidation in people's mind. But at the end of the day, I would take anything that has been studied if it gives me any chance to have a better outcome if infected. And certainly the Pfizer and the Moderna, I think right now is our best option.
Tuesday, they lowered the age to get the vaccine to 16. And I guess I just want to share that we'll give Barker the link to be able to sign up to receive the vaccine.
So I don't know how one engages to get it. So we have to check. There's public health information about that. Everything that I do is through the hospital. So that's not the mass vaccinations. I know that they're standing up some mass vaccinations in the state very soon. The National Guard will be involved. Office of Public Health is involved. I do believe that some of this will be the Johnson & Johnson sort of one-time done. And the thing that's nice about Johnson & Johnson, by the way, it's only 1 shot. So first of all, you don't go through it twice, so that's good. And second of all, logistically, having people come back is very problematic. It's difficult to do. Even within our own hospital population, the logistics of that is not trivial. So if you extrapolate that to the general population, some of which have difficulty with getting a ride, and just pick your reasons why someone doesn't show up to an event, you can imagine how difficult it is for a vaccine that is very sensitive to, when you thaw it out, if they don't show up. They can't just come tomorrow, right? It's not like that, because the vaccine was defrosted and you have a very narrow window to give it. So for all those reasons is why I think the Johnson & Johnson is a very effective means to vaccinate large scale and feel comfortable that you're doing so. As far as the age groups go, the governor did lower it down to age 16. There are comorbids that go with that. So any old 17-year-old kid, totally healthy, probably still doesn't qualify yet. They do want some kind of medical problems, and there's a list of those things and that are available. But if you qualify for those, then you do qualify to get the vaccine. And then after that, it's a matter of scheduling and where it's at.
All right. Thank you.
So just a couple more things. So I'm going to pivot now off COVID. I want to talk a little bit about the hospital. So we've had some exciting things happen even amidst COVID. Probably our biggest excitement has been that we have joined in the Our Lady of the Lake Robotic Institute. So there are certain surgical procedures that are being done and have been done for many years using a surgical robot to assist. So we have for a very long time wanted to have one. Our doctors have wanted to have one. Their option was to go into Baton Rouge to do the surgery, and it's just very problematic to move patients and whatnot. So we really wanted to try to establish that service here. So one offshoot of COVID that I'd say was a positive was the companies that have the robot were able to give us one for a much reduced rate as a trial period, and to see if it made sense for us to use it. And it was really on the heels of COVID, because so much surgery was reduced that they knew there's a large backload of patients. And so we were able to piggyback on that program and bring a robot to our facility. So our surgeons were, of course, very excited about this, and they've done quite a few cases on the robot and have had tremendous success with it. So I feel confident that we're going to keep our robot, and we're now part of the Robotic Institute at Our Lady of the Lake. So we're actually having an open house with the Leadership Ascension, of which I'm a graduate, year 2000, Go Red Team, if you know what that is. And so anyway, we're having a Leadership Ascension to come through, and it's part of our program, and see our robot. We're going to have a loaner that's brought here that they can visualize, and our surgeons are going to be there to sort of demo it. So that's been a really tremendous shot in the arm for the hospital and just for the community. I think really kind of moves us into another level in terms of surgical procedures and whatnot. So very excited about that. We have a new bariatric surgeon that is starting with us. He is from Cleveland Clinic. He is world-renowned bariatric surgeon, started the program at Cleveland Clinic, really put it on the map. And we were very lucky to have brought him into our community. He's going to be at Pennington, where his main office is going to be located, but he recognized the performance level and the patient satisfaction level and just the quality that we provide here. And so he asked if he could come and participate at St. Elizabeth for some of his surgeries. So he actually has 3 cases scheduled on the 24th of this month. So we're very excited for Dr. Showers to come down and use our little facility. And if I can carve out for him sort of a center of excellence for his particular specialty, for that patients that come in kind of experience the community level of engagement that we all feel living here in Ascension, I think would be a wonderful part of his program. And I think his patients would really appreciate it. So we're excited to see him get started down here, and look forward to seeing that program grow. And then we have a new urologist. Dr. Campbell was our urologist, and we loved her. But for personal reasons, she decided that she wanted to move on. She actually joined Oshner, and we wish her well. But we certainly wanted the service here. And so we have a new physician who had joined. His first day in the clinic was yesterday. His name is Jason Bridges. And we're very excited. He's extremely well trained. I his medical school was at Rice, and his residency was Baylor, I believe, in Texas. He's actually been in Baton Rouge for a number of years, saw the Ascension environment as an opportunity. So we started to speak to him, and we're very, very excited to bring him on board. And he seems thrilled to be here. So again, he is a heavy robot user. So it fit with our Robotic Institute to have urology come down and start being engaged with us and use the robot. So we're excited about that. And then we have some other primary care docs that we're trying to hire as well. So everything's, despite the COVID world, we're trying to keep the facility moving and going forward. So, but otherwise, we're doing well. The hospital's doing well.
Somebody's familiar with Dr. Bridges, and they've made a comment about how wonderful he is in addition to our community.
Great. Well, yeah, I think a year from now, he'll be looking for help. He's going to be busy. So
I do want to go back to bariatrics and ask you a question. You mentioned Center of Excellence. St. Elizabeth Hospital has been bariatric certified for quite a long time. So how is that important to our community? Not only having the certification, but having that service.
So being identified as a Center of Excellence is a distinction in which when you perform and do certain procedures, you have to have a certain level of quality, performance, expertise in order to get that distinction. And so a number of years ago, we went through that process and we received that distinction. So with Dr. Showers showing up, who is a national leader in this environment, we felt it was a wonderful pairing for us to share with him that this facility had received that distinction, and that he then would be comfortable, should feel comfortable, and his patients should experience a very, very good experience after coming to St. E, given that we had gone through that process. So he immediately latched onto that and felt very comfortable to come here to be able to do that. So it's just kind of a nice partnering, if you will, with where we've been, having a new physician in the community, and then bringing those two facts together, those two entities together, and then moving forward. So, it's exciting to see where we can be, where we could become. He came to Louisiana because, and this isn't really something we should be necessarily proud of, but apparently Louisiana has a extremely high opportunity for bariatric surgery to help our patients. Morbid obesity is a community health issue, and we need to, and part of our job is to address any issue within our community that's health related, and certainly obesity is a major concern for us. Having many different processes which would address that is important, and one of them being bariatric surgery. So we're excited to be able to provide that care.
All right. Well,
if there's any other questions, I'm happy to entertain. I do have to get to the ER because I am working today. But anyway, any questions?
Hey, Doctor, we do have a few questions that came up in the Q&A feature, so I'm just going to get to those.
Sure.
I know Yvonne brought up that the age had been reduced, I think, to 16 for vaccination, but somebody wanted to know, is it safe for a 19-year-old to take the vaccine? So
yeah, so in terms of safety, all the age groups it's safe for. The only reason why it was lowered down all the way to 16 and not any further is because that's where they studied it. They didn't study it in a 15-year-old. So the study only went to 16. The danger of the vaccine is the same for all age groups. So there's no difference in danger. The only reason why we withheld it from younger folks all the way down to 16 prior is because older folks are at higher risk if they should get infected with COVID to become ill. So we initially went after the most vulnerable and the frontline folks who are constantly being exposed to COVID to try to protect that environment that population first. And then as they were being immunized and we had more immunizations available, you start to extend this to all the groups that were studied. So it went all the way down to age 16. I'm quite sure there are studies going on that gets it down much further. But what we do know is that the folks who really get sick are the elderly and those who have a lot of comorbids. So So I don't have any concerns at all about the safety part of this for any of the age groups.
And this kind of piggybacks off of that question. Somebody else asked, I guess through the studies, have there been any different effects with the younger population compared to an older adult population?
I don't know of any other different responses to the vaccine for any of the age groups.
All right. And then this is my own question, I guess, for all the ages that have been approved up to this point. Do you anticipate or have an idea when full distribution or access to the vaccine will be approved? Or
I don't know. It's a numbers game. How many people want it and how much vaccine is available. I know that I talked to a guy from Mississippi the other day, and he was asking me, what do I know what the state's going to do with their extra vaccine? And I said, well, it'd be an interesting problem if we had extra. And he said, well, Mississippi's about at a point where those who are asking and the amount of vaccine that they have is becoming more vaccine than people asking. And so I said, well, that's interesting because I don't think we're there yet. But if you got extra, send it over. So the answer to your question, though, is it's purely a numbers game. And I think as more vaccine gets available and as people are becoming vaccinated, then the need changes, right? And so we'll see how that goes. I'm extremely optimistic that the governor moved it to 16 because that's a clear indication that there is enough vaccine to really start hitting everybody. So I think it won't be too long before the governor says, okay, anyone who wants it up to the age of 16 with or without comorbids, the vaccine's available for you, go get it. So I think we're probably close to that. I just don't have the data to say, what's the timeline on that.
All right, doctor. Hold on. I think we have one more. Do you expect it to be an annual immunization?
Yeah, that's a good question. I don't know the answer to that. I think a lot of that will determine kind of how it goes. So, we have flu vaccine that's annual. And the reason is because our ability to fight off flu changes because the virus changes, right? And our immunity doesn't recognize the change. So therefore we get a booster, we get an update. Now for COVID, I don't know. So the variants that we're seeing, the different types of COVID virus out there, the current vaccine is effective for. So unless a variant would show up that we determine that our current vaccine is no longer effective for, would I say, yeah, there's going to be annually updating to make sure that the changes that occur that we're vaccinated from. In terms of how long the vaccination lasts in our body has not been studied because we haven't had the vaccine long enough to study it. I will tell you that as long as COVID is out there, every time, so I'm vaccinated, every time I'm exposed, I'm getting a little bit of a booster from COVID. Okay, so that's enhancing the length of which I will have immunity. So the answer to your question on whether or not we're going to have boosters or whatnot is not known. But there's many pieces and parts of that on the science part of it that we're still trying to understand. So we'll see. It wouldn't surprise me that it becomes sort of a background shot that we get, no different than we get the flu. But I think the data is still not known.
All right, Barker, that's going to have to be the last question because I know has to get to the ED. So we're going to.
Sounds great. I was going to call it too. It's perfect timing.
Yeah. Well, look, it's a pleasure. And again, I'd be happy to come and meet in person and give an update anytime. The chamber feels like they're ready for an update. Hopefully it's good news, and but just let me know. I'll be, I'm around. So thanks again for everybody and stay safe and hope those who recently found themselves ill recover very quickly.
Thank you, doctor. We certainly appreciate you and everything that you do for us. Yvonne, we appreciate you as well. And we'll definitely get you in front of our members in in-person setting sometime soon.